I think I first became aware that I wanted to be a physician because I always wanted to help people. I think I always achieved a lot of gratification when folks were pleased, and I thought that was a pathway for me to accomplish that. Late into my residency, I applied for cardiology, and one of the choices was the University of Florida in Gainesville. And I got accepted. Tremendous opportunity for me to go to a major university like Florida and get that training in cardiology. What I do is I see patients, I try to diagnose their symptoms, whether it's a cardiac problem. So we're going to probably do some initial testing at the office, which may be a stress test, an echocardiogram, an EKG, and try to diagnose if it is even a cardiac problem. Some of the things I feel are important for preventive for patients, I always recommend that they see their primary care physician at least yearly, because there's a lot of things that can get picked up even before you have symptoms. It's always easier to treat disease at the earlier stages. And so a good routine physical, once a year, lab tests would be recommended. Knowing your cholesterol, knowing your blood pressure. These are silent things often, hypertension, high blood pressure, and without having a gauge on that, months turn into years and the damage can occur without having any symptoms. By the time you get symptoms, it could be more advanced stages and harder to treat or takes more medication. Patients are often afraid to see their physician because they're afraid they're going to hear bad news, but they should also look at it as an opportunity to prevent some major illness. The earlier we can intervene, the better the outcomes can be, and I always like to replace uncertainty with certainty. I'm always bragging on the expertise of our physicians. It got me here to work with a great, talented group of physicians. When I see my patients every day, I can look them straight in the eye and say, "You're going to the best," and not, waver in that. I treat my patients like I would my own family. I wouldn't be able to give them lesser care or feel like they're not getting the best care that they can possibly get. Every day I feel that way.